And joining us now is Dr. Farhan Bhatti, family physician in Michigan. Great to have you on this morning. Before we get to what's going on specifically in Michigan, I just wanted to get your take on the breaking news that we got this morning. The FDA recommending a pause on administering the Johnson & Johnson vaccine here in the U.S., citing issues of these rare blood clots. What do you make of that decision and just this situation in general?
I think I would just urge calm on the part of the public. We don't know for sure that the J&J vaccines or the AstraZeneca vaccines actually do this. We do know for sure that COVID-19, the disease, significantly increases the risk of blood clots. And so I'm glad that the FDA is looking into this. You know, anytime that we have any potential for any possible side effect, I think that we should absolutely investigate. And I think, if anything, it should give the public more comfort that the FDA is taking vaccinations very seriously and the safety of vaccinations very seriously. But it does not mean at this juncture that the vaccine is unsafe and that people who have received it need to worry.
Okay, so right. If for people out there who perhaps have already received that Johnson & Johnson vaccine, any advice to them?
I would urge calm. I would say that even if there's found to be, 200 cases out of millions of people that got a blood clot, it does not mean that they're statistically necessarily any more likely to get one. This is protocol. This is what happens anytime a new drug or a new vaccine comes to market. If there's any question of any potential side effects, we push the pause button, we investigate the data further, and then we see if there's any merit to the claims. But I would say for the folks that have already been vaccinated with J&J, I would say, congratulations, and you've gotten protection from COVID-19 as a result of the vaccine, and that's the most important thing. That vaccine is 100% effective in preventing hospitalizations and deaths related to COVID-19.
I want to talk a bit more now about what's going on specifically in Michigan. There's been a lot of reporting that it's currently worse than at any other point in the pandemic. What are you seeing? What is the situation on the ground?
The situation here is a perfect storm. The most important part of that is that the B.1.1.7 variant that we have here is just the most virulent strain that we've had thus far. And so they used to say that COVID-19 only affects the elderly and people with chronic medical conditions. That's just not true anymore. We've seen over 600% increase in hospitalizations for people between the ages of 30 and 39, and an over 800% increase in hospitalizations between people ages 40 to 49. So this is no longer just a problem of the elderly and people with chronic medical conditions. This is affecting all of us because of the strain of the virus that's here in Michigan, that's most prevalent here, as well as in other states. This is much more virulent and can cause illness much more at rates much higher than we're used to.
The governor calling for more vaccines to come to the state, asking for the federal government to ramp up supply. The federal government basically saying no, and that the state needs to kind of figure it out themselves just in terms of shutting down. What is the answer? How do you get this thing under control?
Well, I would hope that the federal government, that the Biden administration would reconsider. It makes just intuitive sense, even if you don't work in public health, that if there's a state that's overly impacted, that's really having a hard time with COVID-19 numbers, that state should get the most vaccines. There are other states across the country that aren't using all of their allocation, that wouldn't even feel a 25% drop over the next couple of weeks in their supply. And those extra vaccines could come to Michigan to really help us. Even after one dose of Moderna and one dose of Pfizer, you get anywhere between 70 and 80% protection from COVID-19. So if we were able to really significantly scale up or ramp up the amount of people that we're immunizing here in the month of April, we could really make a significant impact in controlling the spread of this disease. And we wouldn't have to necessarily shut the whole state down and interfere with people's livelihoods, once again. I'm sure it's on the table, but we would rather not have to shut down the entire state all over again. And hopefully the Biden administration will recognize that and give us a boost here in this month of April.
You mentioned that there are some states that are already having a surplus in supply, where you're saying, 25% drop in vaccinations, they wouldn't really feel it. How worrisome, in general, taking Michigan out of the equation, how worrisome, though, is that to you in terms of vaccine hesitancy in this country, and particularly now with the Johnson & Johnson news? I know that you say it's actually a good thing, right, that the FDA and the CDC really monitoring this and making sure that everything is safe. But are you nervous that that's going to lead to more vaccine hesitancy? And I'm curious if you're hearing from anybody, any patients who are hesitant, what their reasoning is.
Of course I'm worried about it. Every day here in my clinic, we're vaccinating patients. We are a safety net clinic, so we have the opportunity to vaccinate our people. We're giving them the Moderna vaccine, but regardless of which vaccine people are being administered, I hear all the time that people either they don't think it's real because politicians that they look up to all along have been minimizing the risk of COVID-19. Like 36% of all Republicans in the United States still say that they will never get the vaccine ever, which is like the single biggest threat to vaccinations. So that's certainly one issue that people have is, they don't think this is as big of a deal as doctors are making it out to be. But then another common reason why people decline the vaccine is that they're worried about the safety. They're worried that it was supposedly developed too quickly, even though then I will explain that mRNA technology has been around for decades and this isn't actually new technology. But nevertheless, people do have worries about, am I going to get COVID from the vaccine? And then I have to explain, of course not. That's not how the vaccine works. It's just, making your body make a protein that's found on the surface of the virus. You can create antibodies, et cetera. So I spend a lot of extra time every day counseling patients about what the vaccines do and what they don't do and how they work. And generally speaking, the two biggest things that I face are people minimizing the pandemic as a whole, and then people worried about the safety of the vaccines.
Well, such great insight. And thank you for coming on from Lansing, Michigan, which is my old stomping ground. I was a reporter in Lansing for a couple of years, about a decade ago. Dr. Farhan Bhatti, family physician and Michigan State lead for the Committee to Protect Medicare. Great to have you on. Thank you.